美雅醫療集團，你的健康良伴。
Hi, I'm David Fong. I'm a board-certified podiatrist that's been practicing in the Chinatown area for over the last 20 years. I was born and raised in San Francisco and did most of my schooling here in San Francisco. Over the last 20 years, I've become very aware of the needs and the differences in that the Asian community needs for treating their different foot problems. Podiatry is the medical and surgical treatment of foot, ankle, and lower extremity problems, and the various body systems that can get affected are the skin, the nails, the nerves, the circulation, as well as the bones. Okay, the various ways that we can treat these conditions, we can use topical medication, we can oral medication, we can also do injection therapy, as well as physical therapy, surgery, and laser therapy. Laser therapy is a more recent innovation in the treatment of lower extremity problems, and I've been able to use the laser therapy for a lot of very problematic and difficult to treat problems. Some of the common illnesses in podiatry include skin infections, rashes, ingrown infected nails, fungus nails, pain in the heel and the arch of the foot, ankle pain, leg pain, arthritis in the various joints, gout in the joints, also muscle cramps, burning and numbness in the lower extremities. A lot of these conditions are secondary complications to a lot of other general medical conditions that a patient may have, and we also able to address those kind of problems and also take a look at the whole patient, even though they may be just experiencing lower extremity problems. Varicose veins are a very common disorder or problem that we see in the lower extremities. And basically what varicose veins are, it's the loss of the integrity of the veins of the lower extremity. And what happens is that you see these very unsightly, damaged blood vessels in the leg and the foot. And what that can do is it can cause swelling, inflammation, and pain in the leg and the foot. More ways to treat these things or to alleviate them are usually I tell a person not to sit or stand too long in one place, okay, because that can aggravate the condition. Also, we can get them support stockings so they can wear. Also, we can get them supports in their foot, as well as improve their foot or shoe gear so that they can get more stability. A lot of people who experience varicose veins have jobs and occupations where they're required to stand or sit for long periods of time. And what I always encourage them to do is to try to, move and to keep active and not to stay in one place too long so you can get the circulation moving. I also encourage them to do an exercise program and stretching as well as walking program to help their circulation, to minimize the symptoms of varicose veins. Foot care things that we can do to when a patient has problems is that what I always look at is I try to look at the whole patient, even though they're having leg or foot problems. And usually patients will have a generalized medical condition like high blood pressure, diabetes, kidney problems, liver problems, heart problems that can contribute to their lower extremity problems. And one of the first and foremost things I always tell them is make sure that they're also getting adequate treatment by their primary care doctor to getting these general medical conditions under control. Because a lot of times when you have these general other medical problems, they will contribute as well as make these other foot leg problems worse. And also what they do is they cause swelling, they cause decrease healing, pain in the leg and the muscles, because when you have these different medical problems, they, as a secondary symptom, they get problems in the legs. So I always tell them to try to make sure that they keep their medical condition under better control. Okay, one. Okay, second of all, what I like to do is I like to tell them to take care of their bodies more carefully, and diet, exercise, cutting down on smoking, also making sure they get adequately hydrated and drink enough water every day, because that's one thing that I see in the Asian community. They don't like to drink water, so their bodies aren't hydrated, their lower extremities, their circulation's not good, they get a lot of swelling because they're not adequately hydrated. So that's another thing we like to do. And lastly, what I always tell them to do is make sure that they always have good footwear and support in their feet and legs, simply because what that does is it stabilizes their leg and foot better, as well as supports their walking pattern better, so that they can do their normal daily activities without a lot of extra stress on their lower extremities, because a lot of extra stress in our daily everyday life can cause these problems to become worse. Thank you for listening to my advice. Thank you.
美雅醫療集團，你的健康良伴。